Welcome back to my channel. Remember, this is where you get all your updates about studies in Finland and other lifestyle in Finland and abroad. But today we are focusing on the entrance examination in SAMK. First of all, I want to say congratulations to you for getting the acceptance letter from SAMK, Satakunta University of Applied Sciences. In Finland to study nursing. So congratulations on getting the invitation. But the next step now is your entrance examination. What are you expected to? What's expected of you, and how is it going to be like? So, if you are really interested to know all this, so remember, don't go anywhere. Stay tuned and listen to the end to get all the tips and everything you need to know to prepare for your exams on Tuesday, the 26th of September 2023. So let's go straight into it, not wasting much of your time. So the first thing which is going to happen is that, or rather, let me just give you a background story. This year, the entrance examination plan has been changed. So before, it was usually like the entrance examination, the timing is from 6 a.m. to 2 p.m., which means that you can take the entrance examination at your own convenience at any time that you wish. But as of now, they have changed it this year, and this is the first time that they are implementing this one. So what is going to happen is that there is the calculation at 9 a.m. till 9:30. So, and the exam is going to last for 20 minutes, and they are actually you're actually expected to have like 3 points out of 5 to be considered as pass for the calculation. So the calculation, let's talk a little bit about the calculation. I think at some point when you start your studies, for example, it's going to be called clinical calculation, and clinical calculations are done in such a way that you are expected to have like 100%, because you are kind of dealing with medications, and they think that if you don't have 100%, it means that you have probably made a mistake. You will make a mistake on administering either less dose to your patient or overdose to your patient, which is actually you know what it means. So this calculation is nothing special. It's nothing astronomical. It's nothing, you are not expected to do like some mechanical calculations here. These are drug calculations, these are medical calculations, and most of the medical calculations are related to kind of micrograms, grams, milliliters and stuff like that. So for example, you are expected to know how to convert from milligram to gram, from microgram to gram, and from microgram to milligram, all those kind of things. And you are equally expected to know how to convert from milliliters to liters, and from liters to milliliters as well. So those are the kind of things which are expected of you. So I will just give you a quick example. For example, you can be asked like, the doctor prescribe your patient 3 gram of Panadol in a day, and the patient got the tablet that the patient has is just 500 milligram in the package. So the doctor has been prescribed 3 gram of Panadol for that patient every day. So 3 times a day, 3 grams daily. So he's taking 1 gram in the morning, 1 gram in the afternoon, and 1 gram in the evening. But the patient has he bought the Panadol from the pharmacy, but he got just 500 milligram of that. The one tablet is 500 milligram. So how many tablets do you give that patient so that the patient receives 3 gram per day? Those are the kind of things. So basically you kind of think that if there's if the patient has been prescribed 3 gram, and the tablet available is 500 milligrams, so you kind of know that in 1 gram in 1 gram is equals to 1000 milligram. Okay, so if 1 gram is equals to 1000 milligram, that means that one tablet which the patient has, that is 500 milligram, it means that the patient has to take 2 of those tablets of 500 milligrams to get 1 gram. So in other words, the patient needs 6 tablets in a day to be able to receive 6 grams, because of the fact that the tablet that the patient has is 500 milligram. You understand? So the tablet is 500 milligrams. So the patient should take 6 of those tablets to be able to receive 3 grams per day. So those are the kind of things. Just basic conversion, of course, basic division as well. So that is the typical kind of calculation. Don't be scared. It's nothing extraordinary. It's just basic mathematics, and I'm sure you are going to be able to make it through. If you have been able to go through your studies until now, I think it's nothing. It's not a big deal for you. I think it's going to be easy, but you have to kind of refresh your mind on basic mathematics. If it's been a while you haven't done any calculations or any conversion, you should try and check those things before Tuesday, which is when you are expected to write the exam. The second thing is going to be multiple choice. The multiple choice is actually starting from 10 a.m. and it closes at 11 a.m. but the exam itself takes 45 minutes, so you are expected to answer the questions in 45 minutes. And what happens is that there will be like 5 questions. You are expected to have 5 out of 10 points to be able to be considered as passed in this phase of the examination. So what you should do is that, due to the fact that you were not required to submit any proof of language proficiency like IELTS or TOEFL, so you are expected to prove your language skills, to prove to them that you can actually read and understand a passage and kind of answer the correct questions which are kind of asked in relation to that passage in question. So what happens here is that you should be you be able, you have to read the essay questions, or rather the topic, the whatever topic that comes. So you have to read it and kind of go through, and you are able to answer the questions which are asked like multiple choice questions. So you'll be able to kind of tick the correct answers from the wrong answer and stuff like that. So that's basically it. It's nothing too big. It's just to test if you can actually read and understand. So that's the purpose of that part of the entrance exam. So, and the last part is actually a video presentation. I've done a video where I'm telling people about tips on how to do the video presentation, what is expected of you, what you should think, what you should know before and when you are doing the video, how long the video should be and stuff like that. Please, you don't want to go in for these exams, you don't want to take any risks, go and do some videos without watching that video which I've done. So check on my YouTube channel. I'll equally leave the description or the link to that video in the description box. So please go and check that video and keep yourself well equipped for your entrance examination. And before I leave you to go, remember to create your account in the SAMC website, where I'm sure you got the email where there are instructions on how to sign in and to log in and create your own password and username. So don't forget to do those things. Create your password, your username as well, so that you are able to take part in the examinations. And the last thing you should do is to enroll to the course, and there is the instructions on there, and the enrollment key is NNU23 autumn. Don't forget NNU. The first 2 N's are capital letters and the U is small. The NNU, they are all capital letters, and 23, and then autumn is lowercase letter. So you should go and do this. And of course, there is also a tool there where you can kind of practice on how to upload your video, so that you have everything in place. Please remember also, do not use your phone for this interview. Please get it. Do not use your phone or for this exam. it's highly recommended that you use a computer with a reliable internet. So you have to put these things in place, because if your internet fails or your computer doesn't work on that day, it's not anybody's fault. It means that you will be kind of deemed failed for the examination. So, but this being said, I wish you all the best in your exam, in your entrance exam, and I'm sure you are going to be selected. And leave me a comment. Do the usual things, like, subscribe, and leave me a comment on what you want to know, or something that bothers you, or anything that you want to know. I would be happy to kind of give you updates, and of course, if it's something big, I can do a video on that. But of course, as of now, and I will say congratulations in advance, and I wish you all the best in your entrance examination.